In this orthokeratology case, we have a patient whose refractive endpoint is not quite at target. In the right eye, which we have the topos of for right now, there's too much residual cylinder. In the left eye, we're a little bit overcorrected. If I bring up the lens for the right eye, the patient's lens, we can see there's about a diopter and a half in the baseline refraction, and all of that carries over into the post-treatment refraction. Most of the time with wave lenses, especially when we see that there's not enough witherable cylinder corrected, it's because the lens is too loose in the vertical meridian. And we do see a pretty good blue ring going all the way around, but if we look at the actual powers, we're about the mid-30s here, and then about the lower 30s here. So there's still a little bit of disparity. In this case, what I would do instead of tightening the vertical meridian is probably loosen the horizontal and get a little bit less of the seal here so that we get relatively more treatment vertically than horizontally. So this is a freeform lens, so we'll go into 50% mode and aim for a target of about a 15 micron change. So here we're starting with sagittal depth of 815, so our new target will be 800. This is the horizontal meridian. We're going to loosen, so we're going to click up. And we're about 800 there. We'll do the same thing on their side since this is freeform. 811, so we'll be at 796. So the goal here is to get a little bit less treatment on the horizontal meridian and get this residual cylinder closer to about three quarters of a diopter. Overall, if we calculate the EDS and the post-treatment refraction, the patient was still a little bit undercorrected. So another thing I would do is just flatten the base curve a little bit, maybe add in a half diopter. We'll do this all the way around in 100% mode. And then it's a good idea anytime you change power just to check the individual meridians to make sure we're pretty close all the way around. Sometimes wave doesn't apply the changes uniformly, but this one looks pretty good. Maybe we can touch this one up a little bit. And then the other change that you mentioned in the history of the case submission was to possibly enlarge the treatment zone because the patient's having some issues with glare, and that's fine. We always push those out a little bit. For the left eye, the cylinder was a lot less in the post-treatment refraction, so I would just probably steepen the base curve in that eye, reduce the power, and get rid of some of that overcorrection. So those are my thoughts, just a few changes to hopefully get your patient seeing a little bit better. Best of luck on your case.